Good evening, everyone, and welcome to the Urban League of Louisiana's second Education Town Hall, Early Education, focusing on the caretakers. We have an important conversation this evening, and I'm so glad that you could all be with us to participate in it. We know how critical early childhood education is, and that's why we wanted to place focus on the caretakers. We want to think about what the issues are as it relates to being in a COVID-19 environment. We know that there are a number of questions that need answers, and we've put together an amazing list of speakers, as well as a tremendous moderator to move us through the discussion of what I think are some of the most critical questions that we should be asking right now in the space of early childhood education. The Urban League of Louisiana has stood side by side along with a number of partners who have advocated for increased funding for early childhood education. And we've done that because we understand that children who are exposed to quality early childhood education are best suited for lifelong positive outcomes. And of course, children who are not situated for those outcomes. So we've got to really always be in support of early childhood education, but particularly during a global pandemic. And so we're going to look at the space of early childhood education with a COVID-19 lens and ask, I think, some very important questions. We have to ask questions about the conditions of reopening. We have to ask questions about funding, and we have to ask questions about the sustainability of early childhood centers that have been closed for such a long time. Are they going to be able to be open and remain open? And will families be able to hold on to those quality seats, or will they have to give them up? We've got to take all of this into consideration and really have a clear picture about what happens with early childhood education, because we know that so many other sectors that this state is relying on as we continue to reopen rely on early childhood education. So with that, I want to share just a couple of housekeeping items. This town hall is being recorded. We will have the audience in mute, but we will absolutely receive your questions. So we ask that you enter those questions using the chat function, and we'll try to answer as many questions as we can near the end of the town hall. We could not do this without the partnership of Education Trust. Keisha Smith serves as the Louisiana State Director of the Education Trust, and again, we couldn't do it without her. This is our second town hall in partnership with them, but because she's also a former urban leaguer, she is both partner and family. So Keisha, I am so glad to be with you again this evening, and I want to turn the program over to you now.
Thank you, Judy, and good evening, everyone. Yes, once an urban leaguer, always an urban leaguer, always near and dear to my heart. The Education Trust works to close opportunity gaps that disproportionately affect students of color and students from low-income families. Through our research and advocacy, EdTrust supports efforts that expand excellence and equity in education from preschool through college. Our pre-12 work is anchored around key factors that contribute to high-performing schools. This includes high standards, evidence-based curriculum, access to strong teachers and leaders, accountability and transparency, funding equity, college and career readiness, and access to high-quality early childhood education. The Urban League of Louisiana has been a trusted partner in the fight for educational equity in Louisiana. Last week, we partnered on a town hall to uplift parent voice related to school closures. Now this week, we are excited to continue this partnership by shedding some light on how the early childhood sector has been impacted by COVID-19, the importance of high quality early childhood education, particularly for children of color and children from low income families, and how sustaining early childhood education is critical to avoid worsening of inequities. Also to discuss what policymakers can do to make early childhood education more accessible and affordable, and resources for centers and providers. With that said, I am happy to introduce my colleague, Carrie Gillespie, Senior Policy Analyst at our national office. As a Senior Policy Analyst on the 12 team, Carrie conducts quantitative and qualitative analysis and develops EdTrust recommendations for national, state, and local policy and practice related to equity in early childhood education. A native of the DC area, Carrie holds a doctorate in special education and disability studies from George Washington University and a master's in school psychology from the University of North Carolina at Chapel Hill. Welcome, Carrie. I think you have to unmute yourself.
Is this better?
Yes, yes, we can hear you now.
Oh, good. I'm so sorry. It said I was unmuted, but it was lying to me. As I was saying, first of all, thank you so much for having me here. I'm going to dive right in. I was saying that prior to entering the research and policy world, I was a teacher aide and a school psychologist working with young kids, primarily with disabilities, which informs the work I do now. I'm also a new mom to a 6-month-old, which makes early learning much more concrete to me now. But I wanted to acknowledge the research we have from the Center for the Study of Childcare Employment at Berkeley, which shows that early learning providers are disproportionately women of color, and that Black early educators make significantly less than their white peers, and Black and Latinx early educators are more likely than their peers to work as an assistant teacher or aide, and less likely to work as a lead or head teacher. So I want to acknowledge the white privilege that I have, that I bring to this conversation and to my work. I can't understand what it's like to be a provider or advocate of color, and I can't understand what it's like to have to do this work while Black people like George Floyd and Breonna Taylor and Tony McDade are murdered by the police, and to do this work through this pandemic that disproportionately affects Black and Latinx and Native American people and people with disabilities. So I need to listen more than I speak. So I'm really grateful to be here and speak with you today. I'm even more grateful to hear from the other speakers today and take what I've learned back to DC and back to Capitol Hill. So I've been asked to lay out the national landscape of early learning amidst this crisis. And we have a network of advocacy states across the country, and also, of course, we talk to those on Capitol Hill. So I'll give you that perspective. But of course, Louisiana has, like all states, its own complex and rich environment and history. And so what I'm saying may or may not resonate or ring true to you in Louisiana, but I hope it's helpful as a context nationally. And also, just to note, I'm going to use the word provider, and by that I mean people working in the early care and education workforce in all different types of settings, from homes to centers to public schools. It's just shorthand. Before the pandemic, in partnership with NACCE, EdTrust conducted focus groups with providers of color in several states, and some of the key needs they raised were the need to support providers all the way through the pipeline, with resources like tuition, much better pay and benefits, and more time and space to connect with each other and build community and join together to advocate. And now we're really concerned that the pandemic is making all of those needs even more dire. So across the country, we've heard from providers who feel a deep sense of conflict between the love they have for the children and the families they serve, to the safety and health dangers of COVID, and the financial stress of staying afloat personally in terms of their businesses in a lot of cases. And as I'm sure you all know, many places are closed and won't ever reopen. They've had to lay off or furlough staff. They applied for stimulus money and haven't received any. And at the same time, a lot of places are open while risking their own health and facing their own childcare needs, often without paid sick leave or family leave or health insurance or substitutes. And many are figuring out how they will reopen and that they're not sure how families will be able to pay. They're also facing huge costs to maintain safe and clean environments and having trouble even finding cleaning supplies and even food for the children. And receiving conflicting or confusing guidance as to how to keep everyone safe from COVID. And I've actually heard Louisiana called out as having particularly thorough guidance compared to other states. At least that's what we're hearing in DC. So I've just talked about a lot of difficult challenges, and with that comes stress and anxiety and heavy social emotional weight to bear for children and families, but also for providers. And that means we're also seeing a major need, even more so than before, to invest in free, accessible mental health supports for providers. At EdTrust, we're approaching this moment as a time to call for rebuilding the early care and education into the equitable system that always should have been, but never was for children and families and providers. And it reflects what Dr. Aisha Ray calls an opportunity to reimagine early childhood education. We, along with several other orgs, are calling for $50 billion with a B dollars from Congress to stabilize early care and ed. Beyond that, we'll need much more funding and investment. So at EdTrust, we're pushing for full public funding for all of the many types and settings of early learning and long-term strategies to, like Keisha mentioned, increase access to high-quality early learning for young kids of color and from low-income families. And critical to that is respecting the value of providers and the value of cultural and linguistic and racial diversity of providers, and making sure federal and state governments are inviting providers to the table in a meaningful way before policies are built, keeping them at the table while the policies are built, and then getting feedback from them when the policies are implemented. And that's all from me. Thank you again.
Thank you so much, Carrie, for those insights and for helping us our conversation. It is my absolute great pleasure to introduce our moderator for this evening, Ms. Takima Robinson, who has over 20 years of experience in strategic philanthropy, policy advocacy, and fundraising. Takima is an entrepreneur, a social justice strategist, a philanthropist, a mother of 2 beautiful young boys, and an advocate for early childhood education. Takima is the CEO and founder of Converge, a national social justice consulting firm whose purpose is to accelerate the creation of a radically just new world where communities of color thrive. And I can't think of a more fantastic mission than that. Takima, thank you so much for being with us, and the program is yours.
Thank you so much, Judy and Nicole, for inviting me to take part of this. Thank you, Keisha, as well. You and I have worked alongside of each other in the education space for quite a long time. And as Judy mentions, in my former life, I was a program officer in philanthropy where I had the great pleasure of funding early child systemic interventions around quality early childhood education. So we're going to start this conversation off with Mrs. Thelma French, President and CEO of Total Community Action. And Mrs. French, we're going to start off by asking you a couple of questions to get our conversation started. So you have been an advocate in early childhood education for many years, and your organization operates and supports Head Start and private child care centers across New Orleans. Can you speak to the level and type of state and federal guidance and communication early childhood education agencies and providers received during COVID-19? And then also, how is that guidance impacting how you were able to maintain and support the centers while they were closed and also in the reopening process?
Okay, first of all, good afternoon. I'd like to begin by saying that we were blessed to have a leadership team at the federal level, and I will give credit to the senior bureaucrat at OHS, the Office of Head Start, who allowed immediately for our agencies across the nation to be able to close the facilities as they saw fit, but yet retain their workforce, meaning that we've been able to pay our workforce while they have been on COVID leave. Each agency was able to develop their own COVID closure plan. And for our TCA and our partners and our childcare partners, we focused on virtual professional development activities, allowing our staff the opportunity to focus on areas of growth, from the custodians to our teachers to our family advocates, while still constantly being in direct contact with our families and trying to engage our children in home-based learning. I think that has been a real sustainable blessing to our childcare partners and to our staff. I often have to say this to people. Remember, people in Head Start are at 100% of poverty. And the assumptions that they have access to high-skilled technology, to all of the other things that the people in our professional world believe they do, is something that we have to advocate for on a continuous basis. I think my favorite comment right now is, because someone has a cell phone or a smartphone does not mean that they can manipulate applications and do all of the things that the world assumes that they can do from a cell phone. So I think our constant reminder in this time has been, we are a state where 38% of our children live in poverty. And we need to have the resources and the flexibility to meet our families where they are so that they can continue the growth of their children. The other thing I wanted to bring out in response to this is that while I may not have always been an advocate for some of the changes of Act 3, I think in New Orleans, the presence of our network, the New Orleans Early Education Network, which is led by Agenda for Children, has created a space while child care partners, Head Start grantees, policymakers, and advocates can talk, respect, and grow from each other and learn from each other. And I think a comment was made by one of the child care partners in our last discussion, how great it feels to have the big guys, and I don't think we consider ourselves the big guys, the champions, being responsive and supportive of the needs of everyone. And I think we all must remember, it is our future that we're supporting, the little people who will carry us into the next millennium, that we're really trying to make sure this pandemic does not do permanent damage to.
Thank you so much, Mrs. French. Next, I'm going to introduce Calandra Robinson with the Learning Tree Academy in Baton Rouge. Calandra, I'm going to ask you to talk a little bit about what is happening in Baton Rouge. So what's your experience there? What are some of the concerns you're hearing from parents? And what are some of the concerns and challenges you're facing as a provider? And do you anticipate long-term impacts for your center and your work?
Thank you all for having me as a panelist. I really appreciate this opportunity to even be exposed to all of the other panelists as well. But my biggest fight during this entire COVID was my parents. So I had to educate the parents and calm them down. And a lot of them, we are a 24-hour daycare. And so when they closed down, we had to change our hours. So a lot of our parents were frightened. We never did close down. So we had to do, I'm a nurse by trade. So we had to do a lot of education with our parents. I put them in contact with counselors and therapists, because I actually had parents having anxiety attacks and just being stressed out. And our babies can feel when their parents or their mother is stressed out, and it goes over onto them. And they weren't worried about it because we were very transparent with the kids. We explained the process. We, as we were updated, we updated them as best we could to their level of understanding. We did get supplies, and some of the parents weren't able to, go out and buy all the bleach and the Lysol. So I did, along with my staff members, we did come together and we provided masks and gloves and bleach. And we taught them how to clean, with bleach. So we did a lot of educating with them, but I do think it'll be a long-term effect in the sense that a lot of people are still living in fear. The unknown is fearful. They don't know. They're still learning. Things are changing. In the beginning, don't wear a mask, then wear a mask. Don't wear a mask, depending on who or which professional or doctor you're talking to, that can change. It can vary. And so, like I told them, I say it's better to have insurance and not need it than need it and not have it. So let's just wear the mask. And if we don't need them, then that's okay. We'll just look crazy and let us look crazy, and we'll try to stay safe.
Thank you so much for that, Calandra. I think it's important that our audience really hear from you about how your center is supporting parents, right? We know that our early childhood centers do so much more than caring for and educating children. They really are there to support parents. So next, I'm going to ask Kenny Francis, Director of Child Advocacy and Policy Advocacy at Agenda for Children. Kenny, thanks for joining us this evening. So I want you to talk a little bit about Agenda for Children, and not only your organization is providing amazing support for centers across the region, it's also responsible for assessing quality, right? So when we talk about early childhood education, there's a real emphasis and intentionality about distinguishing what we mean by quality. So Agenda for Children is responsible for assessing that quality, and is also active in advocating for additional financial supports for early childhood education. So from that standpoint, what are your greatest concerns at this time? Are we looking at a loss of early childhood seats across the state? And what have you learned about the gaps that exist in supporting early childhood education and what needs to be in place? Lastly, as we seek state funding and financial support for providers, how can we make sure equity is at the forefront of our conversation?
First of all, thanks for having me. I'm going to try to stick to my time. For any of y'all that have met me in person, being concise isn't one of my strong suits. So I would start with the first question about what our greatest concern is. Our greatest concern is the collapse of the childcare sector in Louisiana. And I don't say that lightly, and I don't say it for shock value, but the reality is that childcare was in a precarious position for a long time before COVID hit. The overwhelming majority of childcare providers are small businesses. They operate on razor-thin margins because of what many folks in the field refer to as the iron triangle. So the way that works is that to remain a solvent business, they have to be fully enrolled at all times. They have to have all fees collected from parents on time, and they have to charge a tuition rate that the parents in the community can afford. And if any of those things falls out of unison with the other two, the result is financial ruin and then the closing of the center eventually. And multi-month closures like we've had over the last couple of months during COVID, where several of those things were not happening, will have only made that strain worse for centers across the state. We did a survey with Libby and the Policy Institute of centers across the state, and it showed that 70% of centers statewide have closed their doors during the pandemic, and a third of them reported that they will not be able to reopen their doors without significant financial help. We're talking over $30 million in losses statewide, and that data was from the end of April. So it's old data now, and those losses are likely higher. So yeah, if we're unable to help, if we're unable or unwilling to help these folks, we will absolutely see centers closing for good. And the childcare access crisis we already had in the state will only get worse, and we know which families will be hit the hardest if accessibility goes down. There's been a lot of talk about restarting the economy, and the simple reality is that most workers have kids at home. So you're simply not going to be able to get folks back to work without them having access to affordable quality childcare. And in order to make that happen, we need to make sure that providers have access to the supports they need to stabilize their businesses, support their staff, and ensure safety for their kids and families and staff. And what this tangibly looks like is providing them with the financial supports they need to cover expenses, to helping them get consistent access to PPE and sanitation materials, and access to COVID testing so that cases can be identified and isolated before we get into a situation where centers become clusters of outbreaks. And so I would say that covers our biggest concerns on the first one. On the second question you asked about what have we learned about the gaps that exist in supporting the sector, one big issue and one of the biggest issues that we face is facilities. Facilities are a huge issue for childcare. It's the number thing that we are told over and over and over by childcare providers that prevent them from opening or expanding is access to the resources needed to purchase, lease, or finance a quality facility. When you start a school in the K-12 sense, you're provided with a taxpayer-funded facility to do so. But when you start a childcare center, you're on your own, and folks end up trying to get loans from banks on their personal credit to finance the facility costs and things like that. And so if we want to try to increase or even maintain access, we have to find solutions moving forward to investing in quality and appropriate facilities. And that's going to have to look like both private and public investment to be able to move that forward. The second big thing that we've learned during this time is that we need to help centers solidify the skills and knowledge to implement more sound and efficient business practices. The debacle that has been the rollout of the federal payroll protection program has shown a bright light on inequity that we already knew was there. Large nonprofits and businesses that have the kind of resources where they can employ a grant writer or a full finance department have taken up most of the resources from programs like the PPP. Meanwhile, centers and other types of small businesses have been scrambling to understand the requirements, get their paperwork together, and make sure that things were in order. And what we saw is that many ended up getting locked out of funding because it ran out, or they weren't able to apply in time, or that they were in danger of, if they got it, those grants becoming loans because of improper filing. We've been working on an initiative with United Way to help with this specifically, but we have learned through this process that supports around business practices need to be scaled up considerably if we're going to give childcare centers any sort of competitive advantage in a scenario like this. The third thing that I would say that we have learned is that our knowledge on demand for childcare seats and available supply currently involves way too much guesswork, and it makes our role in trying to help meet the needs of both families and childcare providers a tough one. The most reliable way that we can predict demand is birth rates, but childcare isn't compulsory like K-12. So we mostly have to guesstimate on what a family's preferences are. Do they want center-based care? Do they want family childcare? Do they want to send their kid to childcare at all? And so it's tricky on the supply side because funding is tied to enrollment. So you can't ask a provider to create a seat and then not give them a kid to fill it. That could lead to financial ruin. So we're constantly behind in the game in terms of trying to figure out and trying to catch up to what the demand is and then trying to match that to the available supply. And we don't currently have any sort of systematic way of collecting information on where or not we have enough quality access to meet the demand. Why families choose to put their kids in childcare or don't choose to put their kids in childcare, which providers are choosing, which providers are not choosing, and what reasons. And so I think one of the things that we need to do is develop a system to assess this somehow and gives ourselves more dynamic data to plan from. There are some states, Texas comes to mind specifically, that are exploring building systems like this. And I think as a state, Louisiana needs to do the same. And to get to your last question about how can we keep equity at the forefront of this work as we advocate for state funding and financial support, there's a lot of things that I could say here, but I'm going to use my time on this one to talk about what I feel is the most inequitable part of the childcare sector, which someone already mentioned at the beginning. Over 90% of workers in the childcare sector are women. The majority of these women are Black women, and these women do highly skilled essential work, and in return, we pay them poverty wages. Many childcare workers can't even afford to send their kids to the centers that they work at. The national average for childcare workers is about $10 an hour, and the majority of them don't get access to employer-provided healthcare or any other kind of benefits. So to put this bluntly, for decades, we have propped up childcare by placing the burden of this labor on egregiously underpaid Black women. This reality is part and parcel of the systemic inequality and racism ingrained in every system in this country. And now we're asking these folks to do this highly personal work because there is no such thing as social distancing with childcare. We're asking them to do this work during a global pandemic that is killing Black folks at a faster rate than anyone else for $10 an hour with no health insurance. It's not right. It it keeps me up at night. So I think that in every single conversation about equity in childcare, it needs to begin with and center on when are we going to start paying these women a fair wage for the work that they do? When are we going to start guaranteeing the protections and benefits that they absolutely deserve? It's a condemnation of us all that we've allowed this status quo to continue for this long. So as we organize and as we advocate and as we push for funding and financial support, we need to remember that while there are so many things about childcare that needs more funding and resources, the women that do this work every day are the most important part of the puzzle, and it's a way past time that they got their due. If we're not going to do it now as we try to rebuild things, when are we going to do it?
Thank you so much, Kenny, for that. You brought up a few really important points that hopefully we can start a conversation around here today. So I want to invite everyone who is listening to start using the chat feature to send in questions. We are going to have a robust Q&A after we get through all of our speakers. But again, Kenny, you said a couple of things there. You talked a lot about the collapse of the early childhood education system in Louisiana as the biggest fear. We know so many of our businesses, so many of our parents are relying on this system so that they can return to work. But you talked about the double burden that many Black women who work in these early childhood care facilities are facing, a choice to go back into work to take care of, to do the work of caring for children without protection, particularly health care, and being able to support their family on a living wage. So we want to continue that conversation with our next speaker, Belencia Breaux, Director of the Clarence L. Barney Head Start Center, part of the Urban League of Louisiana. So Belencia, a few questions for you. Not only are you an expert in early childhood development, but you also have the challenging role of supporting parents and families over the past several months while the Urban League's Head Start Center, the Clarence L. Barney Head Start Center, was closed due to the pandemic. What are some of the concerns and challenges you are facing as a provider of early education? And we hear a lot about the risk of learning loss. So we talk a lot about that in the K-12 space. Can you speak to whether or not that's a phenomenon in early childhood, and what does that look like?
Good evening, everyone. Prior to responding, I would like to take a moment to say thank you to the Urban League of Louisiana, my boss, for including me in this valuable discussion this afternoon. My responses are generated from conversations among our Head Start team over the past few months. During the early days of the pandemic, the Urban League Head Start team was charged with surveying families in an effort to identify their immediate needs. Overwhelmingly, the greatest need expressed by parents was when would the children return to school. I was initially concerned that when the children returned to school was the most identified challenge that our families was facing. Why was it not the possibility of contracting the virus? Why was it not having access to personal protective equipment? Why was it not being unemployed? Why weren't any of these our family's greatest concern? We realize that the care of children and their being in school is for many of our parents the focus and the center by which they function. As early education providers, we understand the magnitude of trust and faith parents place in us. When children are enrolled in high quality early child care settings, parents are able to go to work and or attend school themselves with the comfort of knowing that their children are being nurtured and well cared for. Therefore, one of the greatest challenges we as providers of early education is facing is how can we become a stronger support system for families? How do we make sure every family has the necessary tools that complement the work our teachers are doing with the children in the classrooms? How do we encourage parents to play a more active role in their children's social, emotional, cognitive, intellectual, growth, and fine motor development? How do we encourage parents as their children's first teachers? How do we support families while adhering to early learning guidelines as outlined by the Office of Head Start and the Louisiana Department of Education? Yes, it is true. There is a risk of learning loss for infants and toddlers due to the centers being closed. As adults, we are in charge of and responsible for our own actions and patterns. We are in charge of the adaptations that every one of us has been forced to make. For infants and toddlers, this is quite the opposite. They are 100% dependent on us for everything that happens in their lives. As providers of early education, we believe children learn by example, through trial and error, recall, meaningful conversations, feedback. Routine and a daily schedule are crucial in early development. While children cannot tell time, they have a clear understanding of what happens next throughout the day. In mid-March, the schedules to which children in early learning settings was accustomed changed in the blink of an eye. No longer were there set moments for circle time, engaging in learning centers, having nutritious meals, and learning personal self-care skills such as potty training. Many of the gains infants and toddlers were able to accomplish from August through March were lost. We have evidence of such through our contact with parents throughout the pandemic. Our team is preparing for the reopening of the center. In our present conversations, we are planning a more robust parental involvement component to our program with the goal of making sure we are better equipped to help parents in having the tools they need to support the children's learning. In closing, as providers of early education, the Urban League of Louisiana, Clarence L. Barney Head Start staff will continue the quest to support families in their drive towards self-sufficiency as we mold young minds and assure our children are kindergarten ready. Again, thank you very much for the opportunity to participate.
Thank you so much, Belencia, for sharing your expertise as well as the experience there in your center in Baton Rouge. And thank you for underscoring and reminding us about the amount of trust and faith that we are placing in our early care providers by entrusting our children with them, and all the ways in which you are stepping up to support families at this time. So next, I'm going to introduce you to Jamie Burton, RSW and parent from Baton Rouge. Hi, Jamie. You there? So as Jamie comes on, Jamie, I want you to help us with the following questions. So as someone who is a parent of a 4-year-old in an early childhood center, what's your experience serving also on Mayor Broom's ACE Council in Baton Rouge? What has your experience been trying to access quality care and supporting your child's education during this time? You also have extensive experience related to childhood trauma and adverse childhood experiences, otherwise known as ACEs. Can you share how you are supporting your child and how other parents can support their young children to mitigate any long-term impacts of COVID-19?
Okay, can you guys hear me now?
We sure can.
Okay, great. Hey, thank you so much for having me. Well, okay, so today I'll just be speaking solely from just a parent's point of view. For the sake of the conversation, yes, I am a single mother of 5 actually, and my youngest is 4, my oldest is 17. And so this experience of, dealing with this pandemic and the I guess the condensed period of time we've had to prepare for it has been quite overwhelming, to say the least. The young lady before me spoke on how parents primarily were asking about school, when are kids going to get back to school, because it, was, I guess, the parents' ability to be able to focus while kids were in school and being cared for so they could work and do whatever else. And that totally resonated with me. So it has been quite the experience. As far as my 4-year-old, she was not, I think the question related to being able to find access to quality daycare. She was not in daycare at the time that all this went on. She was actually attending a Head Start Learning Center. And I don't know if to say fortunately or unfortunately, but I was I'm able to work remotely. So I was able to be at home. So I wasn't necessarily pressed to find a daycare facility for her. And obviously the childcare center that she was at, they closed or whatever. But my experience with that was, it was very little communication, and I think that, and being that I have kids in high school, I have kids in elementary school, and then I have my son's in middle school going to high school. And so everybody's at different schools. So I was able to kind of see how different schools responded. And it was just all over the place. Some of the schools my kids attend they had, really good communication skills and let the parents know we were aware of virtual learning opportunities. And then you had some of the schools to this day haven't heard anything. No correspondence in the mail, no email. It's just like, what is going on? And that's really as it relates to my 4-year-old. The particular learning center she was at, I mean, it was just like very little communication. And that's not to, and I haven't, I'm not saying the name or anything, and that's not to throw anybody under the bus, but it's just to say that there's some parents out here, and we're just like, what is going on? And it has to be a better system, because obviously it's just not very efficient, depending on what school your child attends, or what learning center they attend or whatever. Supporting my child and my children during this time has been an adjustment. Like I said, some of the schools, about the virtual learning opportunities and activities, and they log in on every day. You have teachers checking in. As it relates to my 4-year-old, not so much. So I've had to just kind of come up with my own curriculum, and I know some of the things that she was learning while she was in school. So I would just build upon those skills with her and set aside time to do those things with her. And then my older kids, her siblings, help out with that as well. My primary concern as a parent is really going forward, though, because she's moving toward pre-K. She's going to pre-K, and she was accepted at a school in pre-K prior to all this going on. So I know where she's going to attend. I'm just hoping that, like the young man was speaking of earlier about, just the seats are already limited, and if we're having to do this social distancing thing, and you just don't know what the layout of the school system is going to be going forward, I'm just concerned about that. Like, what is that going to look like? And early childhood is so critical. Early childhood education is so critical. I don't want her to miss out on the most important piece to her learning process, so I'm more concerned about, like, what does this new school year look like? So far, I haven't heard anything. I haven't heard much as it relates to enrollment or whatever we're doing. So I would just like to have questions and or answers to those questions. And transportation, when we talk about access to quality educational systems, it's just like, what's up with the transportation? I was told that transportation isn't an option for pre-K. I really feel like that has to change, because everybody doesn't have transportation. And when you're talking about access, you have to think about transportation. So hopefully that's something that'll change.
Thank you so much. You want to talk a little bit more about adverse childhood experiences, and do you have concerns as a parent about long-term impacts, and how might you be thinking about supporting your child around those things?
Absolutely. I have concerns about long-term impacts. because it's a real thing. You know, when we have unaddressed childhood trauma, it shows up in adolescence and in adulthood, you know, in various ways. From physical, it manifests physically, health-wise, mentally, you know, all of that. So absolutely, I have concerns about that. And my way as a parent, I guess, to mitigate some of that impact is being self-aware. And you know, because I don't know who said it, but I know it's a quote, is I cannot pour from an empty cup. And so for me, being self-aware, and I would encourage parents to first and foremost be self-aware of your emotional and mental capacity, because we can't give what we don't have. So it's important for us to do that and to self-care, develop self-care skills, because it's not selfish, it's necessary, you know. So aside from that, it's just also being aware of where my kids are. You know, a lot of times we take for granted, we just think kids are kids, they don't have feelings, they don't have emotions, they don't have, well, we know they have emotions, but you know, we just take for granted, like, oh, you'll be okay, you're a kid, you got your whole life ahead of you. And that's, you know, it's just maladaptive. It's not conducive to building a healthy environment for a kid and building a child with healthy emotional and mental capacity. So being aware of where your children are, do mental and emotional check-ins, you know, ask them how they are, teach self-regulation skills, whether it be deep breathing techniques, meditation. My 4-year-old literally will duck off somewhere. It's like she's sitting in her little meditative pose, because I do yoga and meditation at that, you know, so they kind of learn from me. And she'll, what are you doing, Riley? Oh, I'm meditating, I'm calming myself. You know, these are learned behaviors, but it's legit, you know, what she does to calm herself. I would encourage parents to do activities together. One of the core protective systems we talk about as it relates to ACEs is attachment, building belonging and attachment. You know, that's so important for kids to understand that they belong, to build healthy attachments with caregivers. You know, letting them know that their environment, that where they are is safe. You know, building safe environments for them. So, and then those activities don't have to be anything, you know, special or costly. Invite them in the kitchen to cook with you. I wanted to redo my flower bed. I had all 5 of my kids outside. We were, you know, out in the yard redoing the flower bed. Now, nobody report me for, you know, labor law, you know, free labor, but you know, it was just a fun family, you know, activity, and talk about it. A lot of times we sweep things under the rug, or we just think avoidance is the way to go. And it's just really not healthy. Talk about it. Talk and listen, you know, educate the children about what's going on. Don't pretend that coronavirus or, you know, whatever else is going on in the world isn't happening. Have the conversations, because a lot of times the kids have access to the whole world in the palm of their hands. Our kids are on tablets and phones, and whether we're talking about it to them or not, they are seeing it, and they have questions and they have concerns. And, you know, again, reminding them that they're safe, and, you know, therapy, actual therapy, you know, for those, you know, whether you have private insurance or Medicaid or whatever, you can call the numbers on the back of your cars and speak with the customer care center and ask for information regarding therapists that are covered in your network. So, you know, those are some of the things that I would suggest for parents, and some of the things that I actually implement myself to kind of make sense of it all.
Thank you so much, Jamie. As a mom, I'm taking notes, so I appreciate all of those reminders, especially making sure that all of us are taking care of our children, taking care of ourselves so we can take care of our children. So next, I'm going to invite Latara Hart from Pat's Playhouse and Learning Center in Shreveport. Hi, Latara.
Hello.
So Latara, I'm going to ask you to do a little bit about what's happening in Shreveport. What are you seeing and experiencing? How is your center, Pat's Playhouse and Learning Center, being impacted by COVID-19? Talk to us a little bit about your plans for reopening. And then, as we talked about earlier in this conversation, this is a business. So how has the business of the center been impacted what kinds of resources have you received, or what kinds of resources do you need to access?
Well, hello, and thank you so much, Urban League of Louisiana and the Education Trust, for the opportunity to be a part of this education Tele-Town hall. My name is Latara Hart, and my parents have owned and operated a child care center for the last 30 years. I began working for them about 15 years ago, of course, as a teenager. That was my first job. And I have been actively running our child care center now for the last 8 years. I can say that immediately we were in awe of what was going on in our community because the schools rapidly closed for the safety of our children. While we were grateful that our community leaders acted quickly, this was the beginning of great uncertainty. Uncertainty in if and how we would continue to operate, uncertainty in how rapidly this virus would affect our community, and uncertainty in personal health as well as the health of our staff and our employees and our parents. Our child care center decided to not close during this pandemic because we do have several parents that are essential workers. We have parents that are nurses that work in grocery stores. They have different careers within the hospitals. They work in triage, in housekeeping within the hospitals. We have parents that work in nursing homes, and we also have parents that work as food service providers. And they requested us to stay open. Originally, my parents opened the center because they wanted to help families and they wanted to be there for families. So this was nothing new to us because these same essential workers are essential during the holidays as well. So most of the time, if we have to open during the holidays, we will. And they know that we will because we are here to help the family. We're here to be here for the children. And our ultimate goal is to lay a good foundation within the children. So in order to lay that good foundation, and then we have to be here. We have to be readily available when we are needed. Thankfully, the Louisiana Department of Education and the Louisiana Office of Public Health, as well as the Child Care Assistance Program, understood these needs, and they worked tirelessly to assist us in continuing to operate. Many people were laid off of their jobs. Many people were required to work from home, and we also had several parents that were terrified of COVID-19. Therefore, our child care attendance was cut in half. We have only had 3 parents with positive COVID-19 cases, and we had 1 parent that came in contact with the virus. Each of these parents were required to have their children tested, and they were not able to attend our center without a negative COVID-19 test. Majority of our staff, they're in their 20s. Therefore, we had only 1 employee over the age of 60 that asked to stay home, and she's still home right now. She has poor health, so she wants to make sure before she comes back to work, everything is as clear as possible. Although our staff is young and healthy, and we have parents that are as committed to us as we are to them, I have heard that many of the child care centers in our area have had to close their child care centers and hadn't reopened until June 1st. Therefore, there are about 5 child care centers within a 1-mile radius of our child care center, and we are the only center that has remained open during this entire pandemic. The Louisiana Department of Education has held bi-weekly webinars to keep us consistently informed on where we stand within the state concerning the pandemic, as well as how we should be operating within our centers. They have graciously provided funding opportunities to all child care centers, whether you have been closed, open, or plan to reopen. They have come up with different ways to fund these child care centers because they want as many of us to open as possible. The Louisiana Department of Health called us biweekly as well, and they sent us emails regularly to ensure that we are following proper protocols to keep our children as well as our staff safe. With their help, We have been able to positively change different protocols within our center with everyone that we encounter, the children, the parents, and the staff. These are things that they won't be able to just use here, but that they'll be able to use at home and that they'll be able to take with them in the future. It's just really good practices for the children. And it's actually been much easier than we thought it would be to keep them as clean as possible. When they come in the door, we're checking their temperature. They take their shoes off, and we have a specific place where we store their shoes. They have school shoes, which are actually socks that they wear every day. Our employees, we have school shoes for them as well. They do not leave the center, that they change at the door as well. And we sanitize all day. We sanitize so much that the children understand sanitization in a whole new way. What I must say is that we have been tremendously blessed throughout this pandemic. As a result of governmental funding, our center has not only been able to continue to pay our bills, but we have also been able to get ahead on our utilities. So this is one less thing that we have had to worry about. We have been able to give our staff incentive pay for being willing to risk their health during these perilous times and equip our building with the necessary barriers and cleaning supplies to keep everyone safe and in good health. Northwestern State University Child and Family Network here in Shreveport, LA has also been offering webinars for our staff to take as far as health goes and continuing these good healthy practices with our staff between them and the children, and any extra classes that they have needed to take, they were able to take them through these webinars from Northwestern. They were able to work with the state to make sure that we were able to get PPE supplies. It did take a while for us to get these supplies, but when they brought them to us, they made sure that we had as much as we needed. And this has really helped us to keep the virus down within our center. Like I said, we've only had a few parents with cases, and the children weren't able to come, but every child that was tested negatively. Any child that comes to the door with a fever, a runny nose, or a bad cough, we don't accept them until they go to the doctor and they have been prescribed a medication to clear that up, as well as have been tested for COVID-19. With the reopening of phase 1, I can say that we have seen a surge of attendance. So many children have come back, so much so that we have had to hire additional staff. Right now, things look promising for our child care center, and we look forward to seeing how things progress. I do know that different states have been seeing spikes in the coronavirus since they've reopened, but while the future is uncertain, we can truly say that this pandemic has enlightened us to ways to be prepared for whatever may happen in the future.
Thank you so much, Latara. We're going to continue the conversation in Q&A. We have one final presenter before we get into Q&A. We're going to follow up on quite a few things that you just shared with us, Latara. But before we do that, I am going to invite Libby Saunier with the Louisiana Policy Institute for Children. Libby is the Executive Director. How are you?
Thank you.
Good to see you. Before the pandemic, parents already struggled to find affordable, high-quality early childhood education. What is the statewide policy agenda for early childhood education now, in light of the many ways in which it's been impacted by COVID-19? What are the plans for ensuring early childhood education funding remains a priority? And can you speak to funding relief opportunities available to early childhood education agencies and providers? We just heard Latara talk about some of the resources she's been able to access through the state, either the DOE or the Department of Health. And can you talk a little bit more about some of those other funding opportunities that relieve the businesses?
Absolutely, and thank you all for having me. I really appreciate it. I'd like to first kind of couch my comments with this, that prior to the pandemic, we served less than 15% of our children birth to 3 in the state that are at risk. And so usually we serve about 16,000 children that are at risk birth to age 3. And we know that we have really close to 170,000 children that are at risk in our state. And so we're grossly already underserving children. And then this pandemic really highlighted it. One of the questions that you just mentioned was really talking about the statewide policy agenda. And we've spent some time in coalition that many of the people that are a panelist today are part of the coalition called Ready Louisiana. And the ask related to really statewide policy is that we wanted to make sure that the state was using the $67 million that we received through the CARES Act funding, through the Child Development Block Grant, to really prop up the industry, the sector of childcare. Because we knew through the survey that Kenny mentioned earlier that we did in collaboration with Agenda for Children and the other resource and referral agencies throughout the state, we knew that many of our child care providers wouldn't be able to come back. And we also knew that many of our child care providers told us that they did not want to have to take out a loan. They really wanted to have opportunities related to grants that they would not have to pay back. And so part of this statewide agenda policy-wise is really to use that money from the feds, that $67 million, to prop up the sector. Additionally, working with partners throughout the state, we also really pushed hard on the state purchasing the PPE equipment for the early care and education sector. And thankfully that has been done for the initial phase to get child care centers back open during phase 1. The other piece that we're really pushing very, very hard on is that right now in Louisiana, we are serving approximately 20,000 children on child care assistance. In our state, we can only really serve about 16,000 with the current funding that we have prior to the COVID monies that came into the state. So at some point, those monies, or those CARES Act monies, they will run out probably within the next 6 months. And that's going to leave us in a position that we'll have approximately 4,000 children that won't be eligible for child care assistance anymore, because those monies, those funds will go away, and we know that they're so desperately needed. What happened prior to the pandemic is that our governor had put in his budget $25.1 million to serve 4,000 more children. And so we recognize fully as a coalition and as Louisiana Policy Institute for Children that the state is under immense financial strain. However, we know that to get families back to work and also to have providers be able to reopen their small businesses that, again, are disproportionately African American owned and women running them, that they need more help. And so what we're doing and pushing towards with the coalition, again, is that we really need that $25.1 million that the governor had put in the budget originally. Currently, it's not in there. And so what we're really advocating for, again, is for that $25.1 million to be put back in the budget. If it cannot be done by state funds, which is totally feasible, you know, thinking about what happened in the pandemic, we're advocating for the governor to use these funds called GEARS, and they're education dollars that can be used for higher ed, for K-12, and for early care and education. And so we're asking if there's a way to use some of those funds to really put in the $25 million that are available. That GEARS funding that the governor has access to is $50 million. And so we know that there's potential in those monies to really put the investment in early care and education. Additionally, we know that the need is great. We're going to have more families that are going to need early care and education and need assistance to be able to afford care. What we also know is that the Louisiana Department of Education is in the middle of rulemaking related to allowing families that are looking for work to be eligible for child care assistance, which is fantastic. However, if there are no more funds put into the system, then the families that really need that early care and education, if they're looking for work, they won't have that availability. to them. And so what we're really doing with the statewide policy agenda is putting out a call to action. We do it through our coalition, through Ready Louisiana. We do it to providers such as the providers that are on the panel today. And we also do it to our policymakers to say, you know what, if you really say that children are a priority, then we need to fund them. Because what we know is that when we provide early care and education to children, the long-term impact of that is even greater. And what we also know from research is that when we provide high quality early care and education, the benefits are great. But also what we know from research is that anytime you have an economic downturn like we are having right now with the pandemic, we know that children's development tends to lag behind because families don't have resources. We know that from the Great Depression, we know that from Hurricane Katrina, and we know that from the Great Recession in 2008, that anytime there's an economic downturn, we do see lags in development. And early care and education can help meet that need. And so it's really important that we all talk to our legislators. They want to hear from us. They want to hear what we think is important. And when we talk to them, we need to tell them, please prop up the industry, use those federal dollars, which the Department of Education is using to really help the sector of early care and education. And we need $25 million more in our system to be able to really meet the needs of our children and families so desperately. And then what we've done, besides really galvanizing our coalition to make sure that early care and education remains a priority in our state and with our policymakers, is we've done the surveys. We've done 2 surveys related to the impact of COVID on early care and education providers. We're about to do a 3rd survey beginning next week, again with our early care and education providers, to really talk about the impact of COVID and what's happening to them as they are starting to reopen as we're in phase 2. Additionally, we're hitting the media hard. If around the state we have op-eds and letters to the editors going out, we have interviews by different people that are really invested, business people that are invested in early care and education, to make the case that we know that childcare is the sector that supports all other sectors for parents to be able to go to work, and really the need on that. And then an additional question you asked was really about speaking about the funding relief opportunities. The last panelist really brought up all the great work that the Department of Education has done. They just closed out a grant application process for childcare providers that are part of the quality rating system to be able to apply for a grant. That has closed, but they're going to do a 2nd round of funding towards the end of the summer. That will be really important for childcare providers to be able to access. Additionally, what's going on right now in the legislature is there's about $300 million that's being talked about for small businesses that they can apply for grants. And so childcare fits the bill. You're a small business and you can apply for those grants. Right now, as it's written, is those grants can't be more than $15,000. And so we're having conversations with legislators about that. And if you think about it in the terms of childcare and what we know it costs to provide high quality early care and education, especially in light of the pandemic, that $15,000 is really only one classroom. And so if this is the industry, and it is, that supports all others, then we really need to make that investment in young children. Additionally, as many of y'all have mentioned, many other panelists have mentioned, talked about the payroll protection funds through SBA. What we know nationally and what we know in our state is, as Kenny mentioned earlier, there are many childcare small businesses that are just not set up to be able to receive these funds and track them. And so it really has been important that the work that United Way of Southeast Louisiana has been engaged in to really walk with childcare providers through the process of having good business practices so they could take the payroll protection monies. However, that's really not an option for everybody. And so it really becomes important, again, for grant opportunities to happen. It was also mentioned earlier about this $50 billion that we need at the national level related to childcare. And we at the Louisiana Policy Institute for Children are in constant communication with our federal delegation to say this is really important. We need to make sure that we're going to invest in childcare, we're going to invest in our children, and that we're going to put them first. And so we continue to work with them as well as our state legislators and our partners around the state to really push this idea that we've got to invest and we have to invest now. And if we build back a childcare industry that is exactly the same as it was before COVID, shame on us. This is the opportunity to get it right. It's something to keep in mind that most of our childcare provider teachers, they actually are earning more on unemployment than if they were working, and that's not okay. And so we've got to be able to really support this industry, from the teachers to the owners and to the families, because it's expensive to really provide early care and education at the quality level that we know is helpful and most effective for young children to have.
Thank you so much, Libby, for that. That was really helpful. And the piece that you said, the sector that supports all other sectors, I think resonates for all of us as we talk about the critical impact that high quality early childhood education has, not just on child development, not just on supporting families, but also on our economy. Early childhood education centers are businesses. And to your point again, they are the sector that supports all other sectors. And as a state, we are making an investment in our future. So we're going to invite folks to engage in a little Q&A. Again, I want to remind you to use the chat feature to ask questions. And we're going to start with a question around the conversation of equity. So Kenny, you talked a little bit about equity and you brought up the burden of labor. You talked about how 90% of the folks who work in the early childhood space are women, and most of those women are Black women. Many who are making poverty wages and often $10 an hour without health care. I actually want to ask Calandra to respond to that point and talk a little bit about what you all are doing at the Learning Tree Academy in Baton Rouge and how you all are thinking about this question of equity and pay equity as it relates to the folks that you're working with.
Thank you. Well, with my with the family here at the Learning Tree Academy, we go above and beyond. And there are times we're here overnight. There are times we're here at 4 o'clock in the morning if a parent has to be at work for 5. And during the pandemic, when I asked my staff, I say, let's make it collective. Like, do you all want to close down? Because they're leaving it optional. And everybody felt the same way. But what about our babies? Who's going to keep our babies? So when we were blessed with the grant, the first thing for me that I felt like was so imperative was to give them a raise. And just now being able to maintain, you know, the pay rate, because they deserve it. I wish I could have given them more, but that was one of the most important things for me to do, to show like I'm here with you any way I can, because I always say if I had more I would do more. So when I had the little more, I was able to give them more, and I was able to also give them 5 sick days and 5 vacation days that prior to this they did not have. So when they missed work, they just missed, you know, money for whatever hours they weren't here at the facility. So it has been very helpful for us because we do recognize that they're underpaid. We do know, and we are here, we see what they do. And during the pandemic, the requirements and the restrictions were even stricter. So I applaud all of the workers who did, you know, push through and help us love on our babies, keep them safe, and worry with the parents, because like I said, the parents were a big part of what we had to deal with when all of this, you know, transpired. And like I said, when I agree with him, like I was almost emotional hearing him speak about that, because I see it. I see them. I see how, you know, I want to pay them with their work, but have the inability to do so with the funds that we have coming in, with the community in particular that I serve.
Kenny, do you want to follow up on the point that you made earlier about equity? and the workforce?
Absolutely. Absolutely. And I want to start by being really clear that the burden, I don't see the burden to be on Calandra and other center leaders, because when I was talking about underpaid Black women doing this work, I'm including the center leaders in this.
Right.
The reality of it is that the whole system is underfunded. And I'm sure Calandra can tell you stories about her time running center, where I've had many center leaders tell me how there are times where they don't take salaries for months just to meet payroll. So it's not a will to pay their folks what they deserve to be paid. What I've seen over and over and over again is that center directors care deeply about their staff, that they're like family, but they simply don't have it. And the reason why they don't have it is that this whole system is underfunded, because we've always viewed childcare as women's work, and it's always been undervalued, and it hasn't been seen as a public good that it is. And it deserves to be funded as if it's a public good, as if it's the fire department. And that's what the problem here is that we have placed this burden on parents, and then the burden becomes a double burden if you are a childcare worker who's also a parent, where you're just on your own for the first 4 years of your kid's life. And then we wonder why we see these disparities when kids enter the K-12 system. Any developing nation, any sort of developed nation you look at that has good outcomes in terms of education and its populace, they all have massive investments into early childhood education. And it's not this piecemeal thing that we're doing in Louisiana and in America in general. It's actual investment. This is the best investment we can make, and we're just not making it. And part of that is we've propped the system up by paying people poverty wages to do that. Make no mistake about it, if 90% of this workforce were men, there's no way that these kind of wages would be appropriate.
Kenny, that is much appreciated. And I really do appreciate you underscoring that this is really baked into the business model. And this is not necessarily an indictment of directors who, to Calandra's point, when they have more, they will give more. But this is really a systemic business model that we need to address. So the next thing I want to do is talk a little bit about the conversation that came up about trauma. We know, and I know many of us have been in conversations about the mental health impact of COVID-19, not only on adults, but also on children. Ms. French, I'd love to have you talk a little bit about some of the trauma-informed practices that are available and supports that are available to early childhood education providers, and just really help us underscore and understand the importance of providers accessing those types of resources as we think about reopening our centers.
Thank you. I think the first thing that I would like to quote a former colleague, Reverend Dwight Webster, who used to come and do this workshop for us when I worked in homelessness, and it's called Healing the Wounded Healer. And if we as early childhood providers and administrators don't deal with the pain of our staff before we begin to talk about working with our children and our families, we're not healing the wounded healers. So a lot of the resources that the Administration of Children and Families, Office of Head Start, and the Social Work Association is putting out is about trauma-informed and trauma-embedded care. And it must begin. We must take the time to deal with our staff and the trauma that the pandemic and now the recession is having on them before we can expect them to work with their families. We've got to create that space and that time. And I know as we prepare to not only offer a summer session, but to reopen, we are working with our regional mental health partner in this city. It's called Metropolitan Human Services, to look at what are the available resources. SAMHSA has some online resources, but I really know it is important that you work with a practitioner and that you create the space for your staff first to name it, claim it, and own it as we prepare. A lot of our conversation today has been about the pandemic, but officially today, it was declared that we're in a recession and that approximately 100,000 more people will be in poverty because of the recession. In this state, I think the impact will be a lot greater than the numbers that are projected. because of where we stand. And so I think we've got to deal a little bit more with what does this impact look like. We've dealt with the trauma of violence. We've dealt with trauma. You know, these are still the children that are, and families that are dealing with violence as well as death from a pandemic. And so we really need to get those supports, and we shouldn't be afraid to get those supports. But I had to comment on the part of this conversation that, Kenny, you talk about it being a woman's world. What I'm beginning to deal with a lot is that the importance of early childhood education and brain development, and talking more about that. There's still a large perception that infant, toddler, and preschool is babysitting or child care. We have to really talk about the long-term effect of early childhood education on a child's trajectory and opportunities in life. And I think once we begin to stop talking about child care and talk about early childhood education, we begin to change that conversation a lot. And that's just something, as an advocate, that stays in my spirit.
Mrs. French, I actually want to stick with you for a second. We have a question that hopefully you can help me answer. I'm going to lean in on this one as well, but really about what philanthropy can do. So we, have folks who are investing, who are philanthropists, who work with foundations, who are investing in our communities. And throughout this call, we heard about the needs. Where would you say is an opportunity for philanthropists to lean in and invest in this moment?
I think one of the key role conversations I had today with someone from philanthropy was, how can we strengthen your staffing needs? And I think that providing resources for access to psychologists, social workers, or mental health professionals are really going to be needed in a lot of the services and programs. I think of my childcare partners. They can't afford that level of assistance or even training. And those are resources. I'm a big proponent of family-centered coaching. Philanthropy has invested a lot in that, helping people have access to those skill sets through providing technical support is really a place that philanthropy can lean in. I would be wrong to say direct support is not a place that we need help, but I think really having access to the technicians, the social workers, the psychologists are really a key, particularly those who deal with infant, toddlers, and preschool behavior is a real serious need at this time.
Thank you so much. And I guess I'll also add, since I work in that space, is that I think there's many opportunities for philanthropists. There's opportunities at the systemic level to support the advocacy work that we know is going to be necessary to get that 25 million from the state and that 50 billion from our federal government. I think there's also opportunities like the ones that Ms. French just mentioned to us at the center level, and really providing centers with resources to bring in the additional supports that families are going to need, or even gap funding for cash flow. So I think we can be really creative as a philanthropic sector to find ways to support early childhood centers and providers, but also those who are doing the advocacy work to really push for systemic solutions. And I really appreciated what Livy said to us, is shame on us if we come back and recreate the same system we had before, for all the reasons that the folks here on the call mentioned to us. So lots of opportunities for philanthropy to step up. I look forward to those of you who are investing here in Greater New Orleans to continue the conversation with us at the Greater New Orleans Funders Network. So with that, I want to thank all of our amazing panelists for giving your time and sharing these important messages with our audience. And I'm going to turn this back over to Judy Reese-Morse and Keisha Smith. Thank you for having me.
Thank you so much, Takima. You did a fantastic job of moderating this incredible conversation. We are so grateful to all of our speakers tonight. I promised you at the start of this town hall that you were going to be hearing from advocates, you were going to be hearing from operators, and you were going to be hearing from experts. And I don't think I broke my word. I think I kept my word. They were just fantastic. Great information about what we need to be considering when it comes to early childhood education. So much to dive into. We could really have a whole nother hour just going back over what they said. But remember, this entire town hall is going to be on the Urban League of Louisiana's website. So if you missed any part of it, or if you want to go back and revisit anything that was said, or if you want to share it with someone who wasn't able to join tonight, please go to our website tomorrow and you'll have an opportunity to access this town hall as well as our first town hall, education town hall meeting. So just a couple of things before we leave. I want to remind everybody that the Urban League of Louisiana is going to be starting a series of social media posts around voting. We've got an initiative called Wake Up, Go Vote. Wake Up, Go Vote. If you hear yourself or see yourself in that, it's important, obviously. It always has been, and we've got to really focus on voting, voter education, voter mobilization, voter registration, and that's why our social media campaign is going to be so important. That'll start tomorrow, so if you're not following us, please follow the Urban League of Louisiana on all of our platforms. You'll begin to get some great information about the upcoming presidential primary. We also want to remind you to fill out your census form. Go online and participate in the 2020 census. I say this at the end of every town hall meeting. The Urban League of Louisiana has been working since 2019, getting ready for this time. Little did we know we would be responding in the midst of a global pandemic, but as many have said, it is what it is. We still have to respond. We still have to participate. So I implore you, if you have not filled out your census form, please, please go to the Urban League of Louisiana's website. We will direct you to the Census Bureau's website, or you can go directly there. You can download the form, you can complete it, and it is incredibly important. We know that federal dollars are tied to census participation, and we need those dollars now more than ever before. So we've got to have a strong participation rate. Take the time, takes less than 10 minutes to fill out that form. And on the day when in the most solemn and most beautiful way that Mr. George Floyd was laid to rest, we will be having a conversation, a very important conversation about police reform. Our next town hall meeting is scheduled for next Tuesday, starting at 5 p.m. Please sign up now. You can go to our website and get your seat. This is an important conversation. We have got to talk about police forces and complete and total transformation of those forces. We're going to have a very, very, very lively and compelling conversation about the many strategies and the many recommendations that are coming forward around police reform. So again, that's next Tuesday. Please go to the Urban League of Louisiana's website to sign up, get your seat, and share that with as many people as possible. Again, I am Judy Reese-Morse, our service president and CEO of the Urban League of Louisiana. So grateful to all of you for being with us tonight, and we hope to see you next week. Thank you so much.